Welcome to the Zynex Medical NexWave instructional video. This instructional video was created to teach you how to use the NexWave device. You should stop and start the video as you follow along with setting up the device for the first time. After viewing the video, you will have a thorough understanding of how to use the NexWave to maximize your pain relief. Although electrotherapy is considered to be very safe, the NexWave should not be used if you have a cardiac pacemaker or an implanted defibrillator. The NexWave should also not be used with electrodes placed so that stimulation will be applied through the head or so that the stimulation will be applied to the carotid sinus or neck region. For a complete list of contraindications, precautions, and warnings, please review pages 31 to 40 of the NexWave User's Manual. The NexWave device buttons. The on-off button or standby button turns the device on and off. The modality buttons are used to switch between three different electrical stimulation options. The treatment timer is used to set the device to turn off after a predetermined time. Channel 1 and Channel 2 intensity control buttons are used to increase or decrease the amount of stimulation on each channel. The Channel 1 and Channel 2 lead wires connect to electrodes which are placed on the skin. The unlock button unlocks the buttons on the device to allow adjustment during a treatment. An AC adapter may be used to power the device instead of a 9-volt battery. The battery compartment door is located on the back side of the NexWave and holds one 9-volt battery. The device can be clipped to a belt using the attached belt clip. On the top of the device are the lead wire connections for channel 1 and 2. The channel 1 and 2 status lights will flash to indicate that a treatment is in progress. There are two key operating features we need to review before starting our first treatment. Let's review the unlock button and check connection status. To prevent an accidental increase in stimulation or a switch to another modality during a treatment, the button shaded in red will automatically lock after 20 seconds of inactivity. When this happens, a lock icon will appear on the screen. To unlock the button controls, press the unlock button once, or the device may be turned off while in the lock mode. Sometimes, at the start of a treatment or during a treatment, the check connections message will appear in the lower right-hand corner of the display. This means a lead wire or electrode may not be properly attached. Check that the lead wires are fully inserted at the top of the device and at the electrodes. Also, check that the electrodes are flat against the skin. Try and start your treatment again, and if the problem persists, please contact customer service. How to set up the NexWave for an IFC treatment for pain relief. IFC Electrode Placement. Place 4 electrodes around the pain site, making sure the red and black ends of the lead wires are crisscrossed, creating an X over the painful area. When using IFC, you must use 4 electrodes and they must be crisscrossed like in the example for low back pain. Additional IFC electrode placement. Please note that all of the examples show 4 electrodes with the red and black ends of the lead wires crisscrossed. Please refer to pages 17 through 30 of the NexWave User's Manual for examples. NexWave IFC Setup. To turn the device on, press the on-off button once. Then make sure IFC is selected by pressing the IFC button. The built-in timer will automatically turn off the treatment after the set time. To change the timer, each press of the button will increase the treatment time by 10 minutes until no timer is displayed, and then on-off button would be used to end the treatment. Typically, IFC is used every 4 to 6 hours for 40 minutes per treatment. Set stimulation level. Start by pressing the Channel 1 or Channel 2 intensity plus button. With each press of the button, the numbers at the top of the display will increase by 1 milliamp. You will notice that Channel 1 and Channel 2 increase at the same time. Continue to increase the stimulation to a strong but comfortable sensation. IFC Modes. The NexWave has 3 different IFC modes to choose from. Switch between the different modes at any time by pressing the IFC button. Each mode will feel a little different, and you should try each one to find the modes that are most comfortable to you. How to set up the NexWave for a TENS treatment for pain relief. TENS treatment. If pain symptoms are still present after completing an IFC treatment, start a TENS treatment by pressing the TENS button once. Increase the stimulation level on channel 1, then increase the stimulation level on channel 2. Set both channels to a strong but comfortable sensation. TENS can be used as needed to control pain symptoms. Just like IFC, TENS has 3 different modes to choose from. Press the TENS button to move between the 3 different modes and use the ones that are most comfortable to you. One-channel TENS setup. TENS allows for a one-channel setup when the area being treated is smaller and may not accommodate an IFC electrode placement. When using this setup, increase the stimulation on channel 1 only. Two-channel TENS setup. TENS can treat 2 different pain sites at the same time. Increase the stimulation on both channels to a strong but comfortable sensation. TENS electrode placements for different conditions. Please refer to pages 17 through 30 of the NexWave User's Manual for more examples. The NMES modality. NMES is usually prescribed as part of an overall rehabilitation program administered by your healthcare professional. Please refer to your treatment program prescribed by your healthcare professional to incorporate the NexWave's NMES options. Choose NMES by pressing the NMES button. When treating with NMES, the goal is to get the muscle to contract and/or move a joint through a range of motion. In order to achieve a muscle contraction, the stimulation level will need to be increased to the appropriate contraction level or joint range of motion. There are 3 different modes to choose from. The 30-10 mode will contract the muscle for 10 seconds, followed by 30 seconds of no stimulation. The 20-10 mode will contract the muscle for 10 seconds, followed by 20 seconds of no stimulation. The 10-10 mode will contract the muscle for 10 seconds, followed by 10 seconds of no stimulation. Thank you for watching the NexWave instructional video, and if you have any questions or need technical support, please call customer service.